Hello, I'm Dr. Tony Talibi, and we're here to discuss the 7th Annual Perioperative Medicine Summit held Dr. Amir Jaffer, the Summit Director.
Good morning, Tony. How are you?
Thank you. Dr. Jaffer, would you please tell us about the Perioperative Summit that you're holding?
Right. Tony, the Perioperative Medicine Summit is going to be in its 7th year in 2012. As you know, the last few meetings have been held in Miami. This coming year in 2012, it will be at our same location at the Eden Rock Hotel in Miami Beach. And the dates are March 15th through the 17th, 2012. We have some great room rates available.
Well, what are the highlights of the meeting this year?
Yeah, the highlights for the upcoming meeting are the following. We continue to collaborate with the Cleveland Clinic CME Center. We hold this meeting in collaboration with the Society of Perioperative Assessment and Quality Improvement. So if you are a member of that society, you will be getting a discount on your registration fee. Next year, we have some phenomenal speakers who are lined up to speak at our conference. Some of these speakers include world experts such as Dr. Stephen Cohen, Dr. Cliff Caldwell, who's the author of the ACCP guidelines, along with Dr. Jim Lucatis, who also is an author of the ACCP guidelines, which are the American College of Chest Physicians guidelines for antithrombotic and thrombolytic therapy. Dr. Lee Fleischer, who is from the University of Pennsylvania and is one of the authors of the American College of Cardiology and the American Heart Association's cardiovascular guidelines for non-cardiac surgery. We will also have Dr. Joseph Lee, who is the president of the Society of Hospital Medicine, who will be speaking at our meeting. Dr. David Lubarsky, who's a colleague here at the University of Miami. He is now the CEO of our University of Miami Medical Group Practice. And still serves as the chair of the Department of Anesthesia. Dr. Don Poldermans, who, as you know, has done a lot of innovative work in perioperative beta blockers from the Netherlands. And this year we have Dr. Tanjawar Ravi Kumar from Geisinger Clinic. He heads up surgical innovation and quality, and he will be giving our plenary session that morning talking about innovative models to manage surgical patients. Dr. Jerry Smetana, who's done some pioneering work with the pulmonary risk guidelines, and then Dr. Ted Markanten, who's our heparin-induced thrombocytopenia guru from McMaster, will also be speaking. So these are some of our national and international speakers who will be speaking at the summit next year. So I hope you can join us. We will also have our call for abstracts, which have already gone to press, so you can go online to periopmedicine.org, P-E-R-I-O-P medicine.org, and get more information about submitting an abstract either in the research, innovations, or clinical vignette category. And we look forward to having you next year.
That's actually a very impressive quite list of people. If you're an anesthesiologist or a hospitalist, why should you attend this meeting?
So the goals really of this meeting, Dr. Talibi, are that we like to share the latest clinical information from studies and guidelines for our frontline clinicians. Furthermore, we like to attract a lot of leaders involved in perioperative medicine at institutions from all across the country, so that once a lot of this information is disseminated at this meeting, they can go back to their home institution and start to incorporate them into best practices at their institutions. Our goal really is that institutions across the country use evidence-based medicine really to improve the quality and safety and improve patient outcomes surrounding patients going for surgery. That's really our focus. Our goal is our attendees should go back home, take all this evidence, incorporate it into their practice, and improve the care of patients having surgery. That's our focus.
And finally, what do you think a health practitioner, whether a nurse practitioner, a PA, or a physician, should take away from attending this meeting?
Yeah, I think they'll come away with not only the nuts and bolts of how to manage surgical patients going for surgery, but also a lot of the nuances that exist in perioperative medicine. There's a lot of opportunity to actually interact with each of our speakers. We allow 15 minutes. That's probably the best part about our course, is that each session is followed by 15 minutes of really action-packed question and answer. So we allow this time after each session so the attendees can ask a lot of questions, and that I believe has led to creating a lot of energy within the course and interactions. And this coming year we'll actually, at the end of our first day, we will also have a meet the professor session. So 6 of our profiled speakers will also do sessions where attendees will be able to interact with them in these sessions, ask difficult questions.
Thank you, Dr. Jaffer. I hope that you will all be able to attend the Perioperative Medicine Summit in Miami in March 2012.
Thank you.